One of the big things in terms of an indication not to do a hair transplant is something called DUPA, Diffuse Unpatterned Alopecia. Essentially what this is that, Norwood scale is based on the idea that you are losing frontal, top, temporal, crown hair, but you'd never lose the back side of the scalp. So, for example, a Norwood 7 is someone that has a horseshoe of hair left in the back of the head, unless he shaves it, of course, but that is the only usable donor hair. The rest of the scalp is actually just not usable because they're all bald. But that donor area, even in a Norwood 7, and particularly a Norwood 7, can be miniaturized. They actually could have compromised hairs in that area because it's been thinned out as well. It can also be part of the global hair loss. So in other words, people think, my donor area in the back is going to be pristine. It may get smaller over time. I may lose some of my crown. And I did a podcast on retrograde hair loss. You could even lose hair coming from the back side, the bottom side. And you think, well, that's got to be but there's this sacrosanct, in other words, safe, preserved donor area in the middle of the back side, and that will never be touched. And that's absolutely not true. And in cases where there is miniaturization or thinning in the donor area, that person is not a safe candidate for surgery because those transplant grafts can eventually fall out. And unfortunately, I think that is on the rise. I'm seeing a lot of patients in the office that I just don't think are good surgical candidates because I look at their donor area, but they're oftentimes told that they are good surgical candidates because they're going to a chain or another place where the doctor is not meeting them, just a salesman that has no idea what they're doing, just trying to sell that person a surgery. And it's really a problematic situation. So DUPA, diffuse unpatterned alopecia, is definitely one of the huge things that I'm looking for in the donor area to make sure that you are a safe candidate to have a surgical procedure.